This is a special edition of the Steele Report, digging deeper into Iowa's mental health.
And welcome to a special hour-long edition of the Steele Report. Today's program will examine what many in our state of Iowa are calling a crisis, Iowa's mental health crisis, a crisis which evolves around several issues: mental health treatment, availability of treatment, the number of beds available, and the number of doctors across Iowa to treat mental health patients. KWWL News has produced several reports for this program, and you're going to be hearing directly from many Iowa families being negatively impacted by this mental health crisis. And we're going to take a look at our first example in just a moment. But first, let's meet our panel for today's show. We have assembled a panel of 4 individuals to talk about the issues, the concerns, and some possible solutions to mental health diagnosis and treatment in Iowa, and particularly in the Cedar Valley and Black Hawk County and surrounding areas. Please welcome to our show Chris Latta. Chris is the Director of Behavioral Health Emergency Services at Covenant Medical Center in Waterloo. Tom Ekus is the Executive Director of the Black Hawk Grundy Mental Health Center, which, as many of you probably know, has an ongoing behavioral health services partnership with Unity Point Allen Hospital in Waterloo. Tony Thompson is the longtime sheriff of Black Hawk County, whose deputies and staff often deal with mental health cases during their responses to calls and with inmates within the Black Hawk County Jail. And please welcome Joan Becker, who is very well known and a passionate advocate for individuals with mental illness. Her book, Sentenced to Life, is a chronicle of her son's battle with mental illness. Her son, Mark Becker, is currently serving a life prison term in the murder of Applington-Parkersburg football coach and teacher Ed Thomas back in June of 2009. So we welcome all of you to the show today. I'm really looking forward to hearing your responses and your reaction to what's going on here. The Cedar Valley Mental Health Planning Coalition is working really hard behind the scenes trying to confront this mental health care crisis. The coalition, by the way, is sponsored by Cedar Valley United Way. And its goal is simply this: to measurably improve community mental health treatment capacity and access to services for persons with mental health problems. And who will benefit from these results? Well, that will be Cedar Valley residents whom have been diagnosed or are concerned that they or someone they know may have a mental health problem. So with that in mind, I'd like each of you now to give your perspective about what's happening in Iowa. Where is Iowa falling short? And we'll get into that a little bit more in the program. But Tom Ekus, I'm going to begin with you. What's the problem right now as you see it?
Several problems, Ron. Number one, we've got a shortage of mental health professionals in the state. We are currently 47th in the United States in the number of psychiatrists and psychologists available to Iowans. We are 44th in the behavioral workforce availability staff to provide services to folks with mental health problems. And we are currently 51st in the United States in terms of having enough public psychiatric beds, according to the national experts. That's compounded by a lack of safe, affordable housing for people with mental illnesses and a number of other barriers that make it difficult for us every day to provide services.
All right, Tom, thanks very much. Now, Chris Latta, you work in a hospital setting from your viewpoint, and we're going to see one of your emergency room doctors here a little bit later in this program. From your viewpoint, what's going on with the hospitals?
You know, Ron, it's a sad state for mental health in Iowa right now. We have people that sit in our emergency departments, not hours, sometimes days, potentially weeks, waiting on bed placement. Whether that's within our facility or somewhere else in the state of Iowa, it's so sad to watch this. And you know, Tom already referenced the lack of beds that are available in the state, and that's only part of the problem. Because the other end of this is when we get people into a hospital bed, we have nowhere to send them to afterwards. We don't always need people to stay in the hospital for a long period of time, but we do need a safe alternative to send them to afterwards. And unfortunately, as MHI beds continue to close, residential care beds continue to go away, that safety net is gone. And so unfortunately then what happens is they end up meeting Tony's officers because there's no safe place for them to be.
Yeah, with that in mind, Tony, you deal with this every day, so just tell everybody what you see on a daily basis, because you have, and by the way, you're wearing a beard for a specific cause, right?
Right, we're raising money for cancer awareness.
Okay, so I wanted to point that out.
Thank you.
All right, but you see a real problem daily in the Black Hawk County Jail and probably in all 99 jails.
In the state of Iowa right now, we are criminalizing the mentally ill, unduly criminalizing them. between 50 and 60% of the population that is currently residing in the Blackhawk County Jail have a mental illness, and that is absolutely wrong. We can train officers through crisis intervention and diversion training, but the biggest issue, as Chris kind of alluded to, divert to what? Right now, it seems that the funnel of mental health treatment ends at the jails. And so every sheriff in the state is dealing with this crisis and dealing with this problem.
Joan Becker, you have a very personal story. I know you've been giving speaking engagements here the last few years.
The story you just heard from these three gentlemen summarized the story our family faced with Mark. We were left with the alternatives of trying to find a bed in a mental health unit, trying to find a room in the emergency room to get care for him, to treat and stabilize him. He ended up in jail several times because of minor things going on because of the psychotic episodes. So this is the gamut. It's so widespread. And without being able to get people to listen and the communication between agencies and organizations, there is a big shortfall right there too. If you can't communicate with others, they are not all getting the big picture, and then things just get lost in the shuffle. And that's what happened to our son.
Now, Mark is still serving a life prison term. He's at Oakdale. How often do you visit him, and how would you say he is doing there? Is he receiving treatment there?
Oh, he has received phenomenal treatment there, and he is doing very well. It took around 6 years of the last 8.5 before he finally recognized, I have an illness in my brain. And since that point in time, we have seen our son come back to us, and it's been fantastic.
Well, that's good to hear. It really is.
But it shouldn't take prison.
But it took many years and a real tragedy that affected so many people. You know, as we talk about why, what's important in the United Way Cedar Valley Mental Health Coalition, what they're doing, consider this information. This is really important, and we'll ask you the question, as we've asked so many people, why is this important? Well, it's estimated that 1 in 5 children in Blackhawk County has a diagnosable mental, emotional, or behavioral disorder, and that really totals more than 5,000 kids, plus many will have a serious emotional disturbance, significantly impairing their ability to function at school and at home. In addition, the information tells us 1 in 4 adults in this area will experience a mental health problem or illness, but these individuals will never receive any treatment because of the ongoing stigma associated with mental illness, or their lack of insurance or even transportation to get to and from that treatment. And as Tom mentioned earlier, Iowa ranks near the very bottom across the entire country, 47th in the country in the number of psychiatrists, psychologists, and psychiatric beds available for the treatment of mental health patients. And get this too, 31% of the Blackhawk County jail population are indeed individuals with a diagnosed mental health problem, and they receive treatment for that problem actually inside the jail. And likely no one knows that better than Blackhawk County Sheriff Tony Thompson. So give me another example, Tony, of someone who's in, you obviously can't give names and things like that. What do you see on a daily basis, and what do you try to do for them? What kind of treatment are we talking about inside the jail itself?
Well, the taxpayers of Blackhawk County spend about $1 million a year in our correctional, mental, and medical health services in the jail. That's something that we petitioned for very hard back in 2009 and now have round-the-clock coverage for that. We have a full-time mental health nurse. And I'm thinking of a specific inmate right now who is currently finger painting with her feces in our jail because there's not adequate. And again, to be the largest mental health provider in the county and have that be in the jail, that's frustrating because that's not what a jail's for. That's not what we're equipped to do, and that's certainly not our forte.
And really, that's good to hear as far as they're getting treatment inside the jail, but as we all mentioned before, why did it have to come to that?
Absolutely.
You know, why did they have to be there in the first place? I mean, beyond the crime, but there's mental health issues involved in over 1/3 of these inmates, and maybe a larger number even.
Well, we're doing transports all over the state to seek bed placement, treatment, those kinds of things. But again, as we triage the problem, proper placement or suitable programming or suitable housing just simply doesn't exist, especially for some of those that are a little more acute or complex.
All right, you know, when we put the word out about this show a few weeks ago, had a chance to hear personally from many, many families looking for help. I wasn't able to get back to everybody via Facebook or those that contacted me, but several families did contact me, and here's one tonight, the Cook family.
When I'm mad, I guess I don't think straight.
10-year-old John Michael Cook is very self-aware. He knows he needs help to control his sometimes aggressive and violent behavior.
Like, I'm just mad, and then I just do it. Like, I'm just like, and I'm just going to do this. I don't really care what happens.
So you're trying to make sure that you get this anger under control.
He gets very angry very easily, overwhelmed, overstimulated.
The Orange Elementary 5th grader can certainly be a charming child, but he has trouble focusing and functioning in a large group environment. His grades have started to fall, but his school has been a big help.
And they are fabulous. I don't know what we would do without the school because they are our constant right now. We live in a well-populated area, and the fact that we have to travel hours to get him help is not ideal. So we sat in the ER for 24 hours, and when I spoke about that, I realized that there's a lot of people that have waited a lot longer than us because there's no money for beds. Nobody's willing to put the money into what needs to be there. There is so many different dynamics when it comes to mental health. You can't just medicate. You can't just see a therapist. You have to have all of it. And to find all of it locally to work together is hard. It's not there right now.
So there's just one example of the several we're going to show you during the program. You know, crisis intervention and short-term care are critical, but the question I have, and a lot of people have asked me as we research this program, what about long-term care? The families that we've seen, they really need that long-term care, and where is it, and how is Iowa going to be able to satisfy the needs of these families who are really in pain?
Well, I can say one thing for certain, and what has happened, and it's not been the intention, is that the hospitals have become that long-term option. You know, historically, in an acute behavioral health unit, we look for a 2 to 4 day stay. Okay, we set people up with outpatient services. We want you to be successful, but we're not a good long-term option. And as MHIs have closed, residential beds have closed, we have a revolving door, and it's so sad because we can set people up with any number of different services, but there's still that problem with follow-through. And you know, we all work collaboratively. This whole table, we all know each other very well, and for a reason. We have to find a way to get a stopgap here because long-term treatment shouldn't happen in the hospital. But again, where does that occur now? We don't have an answer for that.
You know, Tom, you've been involved in this for a long time, and so how has the treatment evolved over the years? I mean, going back to the initial round of antidepressants or antipsychotic drugs, I guess that's where the treatment began. What is different now than years ago? Are there any improvements that we can talk about?
Yeah, I think there's been a lot of changes, a lot of good changes in the mental health system, Ron. When I left MHI as an employee in 1988, we had 400 patients in the hospital. Today there's 40. What happened to the other 360? Unfortunately, some of them are in Tony's jail. Many of them are stuck in Chris's unit. We used to be able to have that as an option for people that needed longer-term treatment than 2 to 4 days, as Chris indicated. There was another placement option in our community, residential care facilities. There's a large one up in Fayette County called Prairie View, where people went that needed 24-hour care, not in the hospital, but couldn't make it in the community. There's an active effort to bring people back to the community, and I think, unfortunately, it's been somewhat short-sighted. They haven't planned well enough. We had the resources. If we had housing, if we had providers, more power to everybody coming back, but we simply don't, so they've almost put the cart before the horse and exacerbated the problems.
Yeah, in fact, during this program, we're actually going to go over to MHI and talk to Dr. Bhaskar Dave about that. He did mention that at one point they had many more beds than they do now. I think they're actually full right now. You mentioned 40. I think he said 55 beds is the capacity right now. And it seemed to me that using those facilities, there's so much room there, might be one option that the state and perhaps the legislature could consider, because the rooms are there. Even though 2 of the hospitals are closed, Cherokee's open, MHI is open, but there's still a lot of availability as far as physical room in those buildings, it seems to me, is not being used and could be utilized.
They also have the infrastructure, Ron. They've
Absolutely.
got dietary, they've got nursing, they've got the services that people might need to look at another option like a step-down program.
But I noticed even just in the last few days, I think MHI had at least 7 layoffs, not in the actual staff of treatment of the mentally ill, but in staff, and that's still never a good thing. Joan, your perspective on this long-term care?
When Mark was arrested after that tragedy occurred, it took almost 6 to 9 months in jail, in a controlled setting, for him to even know us as mom and dad again.
Wow.
So for them to get him somewhat diagnosed and started on medication, for certain individuals that fall in that range with the complex needs, they need a place that they can be stabilized, that they can feel safe, and that we are all safe. Not all of them are like that, but there are some that are, and they need that longer-term care. They need a long-term stay.
All right, you know, one thing for sure is we've learned is that Iowa hospital emergency rooms, as Chris pointed out, they're literally swamped with patients who need immediate mental health care services. Now, I did speak recently with Dr. James Ellis. He's the Covenant Medical Center Emergency Department Medical Director about this problem and that part of the crisis. Let's hear from him.
Absolutely overwhelmed. We're overwhelmed as a staff, we're overwhelmed as a department, we're overwhelmed as a hospital, and the entire region is just completely overwhelmed. We always have security here.
As Dr. Ellis showed me this ER room, he points out that these days, unfortunately, the Covenant Emergency Room is treating so many patients, many of whom with mental health and behavioral issues.
We certainly are well staffed, and we know exactly how to take care of the aggressive patients very quickly, because they're a threat to themselves, and they're also a threat to our staff. So we want to get them under control as quickly as we can to kind of sort of calm the problem.
For that reason, Covenant has installed what they simply call garage doors to keep aggressive patients from hurting themselves or anyone else and from destroying costly medical equipment.
And it comes right down, and it takes all this stuff completely out of play.
Oh, wow, so nobody can throw anything.
Exactly, or, you know, tie themselves up or something like that. Yeah, so the door's right here. It's truly a garage door that just comes down.
Dr. Ellis says additional treatment solutions must be found soon.
One of the big issues is the lack of funding and the lack of community resources. And so they don't have resources. They may not get on their medicines, they may not have funding for the medicines, and then everything just spirals out of control. And the funnel sort of goes to local ERs. Don't know what to do with the mental health patient. The mental health patient's out of control. Law enforcement's not sure if are they medical, are they intoxicated, are they mental health? They all come here. So they end up coming here, and we end up sort of being the clearinghouse on where they need to go at that point.
So thanks to Dr. Ellis for letting us come over to the emergency room. By the way, both Covenant and Unity Point Allen hospitals in Waterloo have mental health areas within the hospital. So I'd like to talk about that just briefly here. Chris, I think you're going to be expanding the emergency room area, right? So tell us a little bit about that, and then how many beds for children and adults are available at Covenant right now.
So let's start with our emergency department. We're actually beginning a process now as we've recognized that folks are staying in the emergency department for so much longer waiting for beds. What we don't want is to have people in a small room for days at a time. Even your most well-adjusted person will not do well in that setting in the long run. So what we're trying to do is we're trying to develop a behavioral health area that is not only therapeutic but allows people to walk around. We're going to have a secured area separate from the general emergency department that can hold up to 4 people, provided that they're medically stable, that they're calm, that they're cooperative, and it'll allow us to have them in a more therapeutic, open environment. The hope with that is that we'll see instances of violence potentially diminished and less opportunities for us to have patients or staff members injured, because it's a very volatile time if you're in the emergency department for that long. As far as our inpatient unit, we have a 20-bed unit. We have 16 adult beds and 4 adolescents. When I say adolescents, we take ages 12 up to 17 in that unit. You have a better chance of winning the lottery on Monday than you do finding a psych bed in the state of Iowa on Monday. And so, generally speaking, we are full with waiting lists in the emergency department. And interestingly enough, you can tell that it's not just us, because really only about 40% of the patients we actually serve come from our emergency department, 60% from outside areas.
That's amazing. And the same way with Unity Point Allen. I know, Tom, I believe they have, 21 beds at least, right? Why don't you talk a little bit about more what's going on in Allen?
Allen has a 21-bed inpatient psychiatric unit. I believe they take kids at the same age, 12 to 17, like Chris indicated, at Covenant. They also have an intensive outpatient program where people can come back to the hospital on a daily basis for several weeks as somewhat of a transition. But same situation Chris has indicated, where frequently the beds are full, there's people in the emergency room, and there's no place to take them. And then Tony can certainly talk about the number of trips sheriff's deputies are making across the state looking for those beds.
Is that a problem, Tony?
Yeah. You know, we're the enforcement arm of the court. And so when we get a court order, either for an emergency committal or some sort of court-ordered committal, not only are we transporting to those treatment facilities, but we're also working cooperatively with the intake at emergency rooms to try and find proper placement. And again, beds are at such a premium that whether it be for funding or hospitals and other organizations getting out of that business because the insurance and the Medicaid, Medicare is not covering the realized expenses, we're traveling all over the state. We may have a deputy in Sioux City at one point, and down to Council Bluffs and down to Davenport and back across the state. We're all over. So that's a frustration for us, but it is as a part of supporting the court and the court order.
You know, participants in the Cedar Valley Mental Health Coalition, they have ranked, and by the way, all four of you are participants in the coalition, so you know what I'm talking about here. You've ranked your priorities when it comes to mental health services in the Cedar Valley. Now, some of the participating organizations include the Blackhawk County Health Department, Blackhawk Grundy Mental Health, as Tom representing them, Cedar Falls and Waterloo Schools, United Way. I don't have time to mention them all here, but they are on this. The top priority is crisis intervention for adolescents. Number 2 is crisis intervention for children. And third, again, crisis intervention for adults. The participants all said the community is not meeting those needs. Would you all agree with that, Joan?
Absolutely. Crisis is the word. We are in a crisis. We have been for a long time. We have all talked, but it's time to act. It's time to get, and this is exactly what the coalition is attempting to do, get their heads at the table, try and present some solutions or some options to move forward.
So next on the list of priorities not being met locally and across the Cedar Valley are mental health screening and prevention for adolescents, inpatient treatment for adolescents, and get this, crisis intervention for our seniors. And that's interesting because while there is a great need for senior crisis intervention, screening and prevention for seniors does get high marks. So participants said that need is being met. But only 3 of the top 24 priorities on this list of needs rated as being met. 14 of the top 24 priorities are rated as not being met within our community. So we were talking earlier, Tony, you brought it up. It all really has a lot to do with funding, doesn't it? And what has happened here, and putting the onus really on the state of Iowa and the legislature.
Well, I think there's no one in the legislature that doesn't recognize that mental health is a need. The challenge for us is how do you fund that need? And really, if you triage all of the different things that the state has to figure out budget for, unfortunately, mental health continues to get bumped down that list and bumped down that list to a point where now we're shutting down MHIs and we're reducing the number of beds available, and that in and of itself, I think, has created much of the crisis that we deal with.
Funding is always going to be an issue. I mean, you can't just throw money at something and expect it to solve the problem, but it certainly is necessary to make things happen.
Oh, and you know, the real struggle is not just a lack of funding, it's a lack of reimbursement. We're asked to do more and more in less and less a period of time, and we have any number of people in this community that are more than willing to serve the patients that the people in this community need, but they need to be reimbursed for it.
And Iowa's very low in the country, if not dead last, certainly back that number 47 or 48 as far as Medicare and Medicaid reimbursement, correct? And that makes it hard even to attract physicians, doesn't it?
Certainly. And you know, I oversee a chemical dependency unit with Horizons, and gone are the days where we could have a 30-day inpatient treatment program. That used to be the Cadillac standard for treatment, and now you have someone that comes in that has a drug or alcohol problem, and we get them through detox in a period of days, and that clock is ticking. That used to be separate from treatment. it's 7 to 10 days max for an inpatient side of treatment, and then we're filming them out, you know, to an outpatient setting, which doesn't give us the time or the resources to really help that person meet their needs, to help make any progress at all. It's sad.
Okay, thanks, Chris. I appreciate that. We're going to take a real quick break right now, just momentarily. We'll come right back to continue our discussion on the Steele Report. We're also going to be online. The show will be in its entirety on kwwl.com. We're coming right back. And welcome back to this special hour-long edition of the Steele Report, as this week we are digging deeper into Iowa's mental health care crisis. Back to our panel here in just a moment. While community-based mental health care services provides most of the local care these days, the state of Iowa has 2 mental health hospitals still open for the most seriously ill mental health patients in our state. Iowa, as you know, has closed state mental hospitals in Mount Pleasant and Clarinda, leaving the 2 others open at Cherokee and the very well-known hospital, the state hospital in Independence, commonly known as the Mental Health Institute. It was built in 1873 to relieve overcrowding at the state hospital in Mount Pleasant. Located on a sprawling land just west of Independence, MHI is the facility of last resort when it comes to treating Iowa's most seriously ill mental patients. MHI is for acute psychiatric treatment. It has been called many names over its 144 years, names like the Independence Lunatic Asylum and the Independence Asylum for the Insane. MHI, as I mentioned earlier, recently laid off about 7 employees, but did not reduce its number of beds from 55. Now, for this program, I did speak with MHI's longtime superintendent, Dr. Bhaskar Dave, about MHI's current role in mental health treatment in Iowa today. He says even before the state closed the other 2 state hospitals, MHI operated at patient capacity and today almost always has a waiting list.
We really are the provider of last resort. And we are a safety net for some very difficult to treat patients who are difficult to handle in the community settings.
Dr. Bhaskar Dave is the longtime superintendent at the Mental Health Institute at Independence. Dr. Dave has worked in this building now for 50 years. And while there's been a lot of talk lately about the shortage of beds, he says the reduction of available beds across the state of Iowa really began more than 15 years ago.
We had 170 beds at one time. Then the recession of 2000-2001 led to a 44% reduction in the beds at Independence, 40% reduction statewide in the state hospitals at that time. So we have had a waiting list for 15 years now.
That waiting list began in the early 2000s when MHI went from 170 beds down to just 95, and today just 55, 40 adults and 15 children, some of Iowa's most serious cases.
The patients that we get are all patients that have had multiple failures in their history. They've been to numerous hospitals without being completely controlled of their symptoms. And they exhibit severe symptoms, aggression, self-abusive behaviors, swallowers of foreign objects, and patients that exhibit problematic behaviors, inappropriate sexual acting out, fire setting. These are the types of patients that are difficult to manage in a community-based hospital setting. And she's showing ways to manage patients who may be assaultive or self-abusive.
This is an MHI training class, teaching staff techniques on how to handle an unruly patient.
All our staff are trained in this advanced system of managing patients who may be aggressive or need to be controlled. The patients that we do have are more complex and more difficult to treat, as well as more expensive to treat. Our patients at times require 1-to-1 staffing. We have had patients who have needed 2-to-1 staffing, meaning there are 2 staff watching that one patient round the clock.
So that's a different perspective from the Mental Health Institute at Independence. Tom, you used to work over there, so you know all about that facility, and it still comes down to funding and things like that. So what's your perspective, following up on what Chris said earlier about what's going on at Covenant?
Well, I don't think anyone on the panel or anybody else wants to be a legislator making some of the difficult decisions, but truly this is one of those issues where it's pay me now or pay me later. Right now, community-based treatment is cheaper, it is more effective. However, without the resources, we have the more expensive, longer-term treatment. The cost of prison and the special needs unit down at Fort Madison, upwards of $54,000 a year to take care of someone with a serious mental illness. We can do it much cheaper, we can do it much better. We have treatment options available if the resources are there, Ron.
And do you think the legislature, I mean, obviously they understand that there's a problem. I mean, that if they haven't faced some criticism within their own constituency, I'd be shocked. So, Joan, you've seen this develop over the years, and you still give many speeches around the country about what happened to your son and your family, and because that case affected so many people. What do you tell legislators?
I tell legislators that you're going to have to make the decision to cross that threshold and move that money up front instead of getting it on the prison side. They're going to have to bite that bullet one of these days. They're going to have to make that decision. People all over the state, all over the country, families are dealing with this. They're frustrated. They're just at their wits' end of which way to turn. And until we can get something moving in that order where they can get the right type of services available, we're going to continue to have this path.
So, are things different in today's society? Is society different, or are we just now recognizing mental health issues more easily? What do you think about that? Is there any way to tell? We know there's a crisis. We know that the emergency rooms and the hospitals are full, but my question is why?
I do think the awareness has increased, Ron. I don't think the prevalence of mental illness is any more than it ever has been, but it's one of those things, it's almost like the field of dreams. If you build it, they'll come. If you go looking for mental health problems, you're going to find it. You indicated the statistics on the number of kids. 1 in 4 Americans. Probably the biggest thing I'm concerned about with the prevention is individuals who develop mental illnesses are usually exhibiting symptoms 7 to 10 years before they ever get to treatment. We have opportunities galore, which is one of the reasons why our organization and the Waterloo and Cedar Falls Community Schools has acknowledged the importance of school-based mental health services. I have 10 full-time people working in the schools to try and mitigate some of the damage that's done by waiting the 7 to 10 years.
Yeah, it just seems to me like the first line of defense has to be the school districts, because the teachers see this every single day. They are aware of what's going on, and that seems to me that has to be at least a starting point.
Absolutely.
That's one thing when I speak to educational groups all over. I strongly recommend that everyone in any school setting should have mental health first aid training. I think everyone in any faith-based setting should have that training. We need to go to the areas where oftentimes these individuals will portray early signs, or families are reaching out for help at early times. No, these individuals at the schools and churches won't be able to professionally treat anybody, but if they could start to recognize signs and start to get services in, just think of what that could do.
And these are all really great points, and I thank you for them. You know, one family said, feeling like you're out on an island. That's how this Iowa family described the process they were going through trying to find help for their son. He's struggling with mental illness. They feel the system in our state failed them, and now all they have left is their son's memory. And KWWL reporter Allie Crutcher tells us tonight this family is now pleading for change so that what happened to them will not happen to other Iowa families.
He brought joy to those around him with his warm smile, quick wit, and sometimes wicked sense of humor.
Sergei Neubauer shined with the joy of life.
He was a fun-loving teenager.
Lighting up in these captured moments, he loved making art.
Mom, I made you a butterfly.
Especially in the kitchen.
He was especially proud to have baked a homemade cherry pie with his grandma Louise. And thought her cooking skills were ninja level, which was true.
Slivers of Sergei's obituary shine a light on who he was. His mom, Mary, wrote it after he died. It also shows what lived behind his smile, a struggle with mental illness. Mary Neubauer and her husband Larry live in Des Moines. They adopted Sergei from Russia when he was 11. When they made it back to Iowa, they celebrated what would be many holidays together.
But what a great Christmas present that was.
Through that holiday and the days and years that followed, his parents found out his childhood in Russia in an orphanage was painful.
There had been years and years of trauma in his life.
A lot of which they found out as he got older. The diagnoses became PTSD, depression, survivor's guilt, anxiety, even pulling out his own hair. Mary says family counseling did help, but not enough to prevent what she calls the crisis point.
He would say so many times, Mom, I've lost my hope. I'm so scared. I want to get my hope back. And
Sergei tried committing suicide earlier this year in March.
He would ask for help.
He tried again in May.
And we, of course, did our best to provide it and did our best to move heaven and earth to find the right providers for him.
Sergei's parents say he was taken here to Iowa Lutheran Hospital, but just for a matter of days. That was short-term care. When they asked about long-term care, the hospital didn't give them a clear answer.
And we were saying, please tell us where we can take him for help. And people often just said, I don't know.
They contacted the 2 mental health facilities in Iowa, one in Independence, the other in Cherokee. Mary says they were told they're not in the Independence service area and to call Cherokee, which she did. That facility told them only short-term care was available to stabilize Sergei, but that's what he got in the hospital. So Mary and Larry began searching the country.
Sitting at our computers, we're searching for facilities across the country to send our child to. You don't know anything more than what you're seeing on a web page.
They researched places for long-term care. For Mary and Larry, that meant a place their son could go for a month, maybe a couple of months, to get around-the-clock care. Sergei ended up going to a facility in Arizona, then to one in California. He spent a total of 4 months out of state. We asked the Iowa Department of Human Services, can someone go somewhere for a month in Iowa to get help? Their response, yes, but it's rare. Mary and Larry couldn't find that here.
Extremely stressful, extremely hard. You're out on an island looking for help.
When Sergei came back home to Des Moines, he seemed better for a little while. But his parents say his depression kicked in again. Sergei took his own life on September 25th. 4 days later, his funeral on what would have been his 19th birthday. After what they went through, Mary and Larry are now turning to the decision makers, the lawmakers in our state capitol, to make a change. We met with State Senator Jeff Danielson and State Representative Walt Rogers, a Democrat and a Republican, bringing Mary and Larry's story to them.
And I say to the state of Iowa, is this what we're comfortable reducing people to? Because don't miss this, that is what we're reducing people to.
We're doing an okay job. I think we're working hard to try and improve the system.
We have either underfunded or closed any other options that they have. And that's wrong.
For long-term care, Mary says think outside the box. Is there any unused space?
And that space could somehow be turned into mental health help.
Here in Black Hawk County, we didn't build a new building. We didn't spend a bunch of money.
He's talking about this crisis center in Waterloo. Short term, yes, but maybe a springboard for new ideas.
But it doesn't have to be new, fancy, and expensive. We can find ways to make it work with existing facilities. And
long-term care, I think, continues to be an issue for us.
The root of the issue, Walt says, is this:
identification, access, and funding. We've got some problems we need to address. We need to address them very quickly.
Ultimately, Mary believes the system failed her son.
Iowa did not have adequate mental health resources during Sergei's times of crisis.
Agree. And there are a lot of ways to measure it. In almost every way you measure it, we are underperforming.
Do you agree or disagree?
I am not sure. I mean, I think one of the things we just talked about is the issue is becoming a major issue across not only Iowa but across the country. So are we in the process of trying to catch up to the overall problem? Yes.
The Neubauers will keep telling their story, not only to help other families, but for Sergey.
By pushing for change, then that's what we want to do, because I feel like we're honoring Sergey and Sergey's memory by doing that.
Allie Crutcher, News 7, KWWL.
So that obviously is an incredible Iowa family story, and Allie talked to Senator Danielson, Jeff Danielson, Representative Walt Rogers. Could we see actual legislation in the upcoming session? And if so, could a bill get passed? And they both told her they don't know. And that's the answer. That is a problematic situation because they don't know what's going to happen. And one area that I wanted to talk about, we talked about his suicide there. Tony, recently at West High, there was a young man that jumped off the roof, and a lot of kids saw that. This is troubling when kids don't understand. They just need to wait a day. It'll be better tomorrow. I mean, what happened there?
Yeah, these are permanent solutions to very temporary problems. And I think all too often we're seeing that as a primary answer and not an answer of last resort. I am fearful that so many kids were engaged with that and so many kids were witness to that.
Right.
We certainly don't want to encourage copycat and you know, seeing that as a final solution or as a plausible answer to a very temporary situation.
Yeah, tell somebody if you're feeling a crisis situation, at least tell your parents or friend or someone, go to the hospital. These hospitals that we've been talking about, Covenant and Unity Point Allen and Waterloo, they do terrific jobs. They do the best that they possibly can under the circumstances. How do you know, though, when someone comes to the emergency room, Chris, that this person isn't just a drunk on a bad night, or they really do mean mental health services?
Well, I'm very grateful for the fact that we've got some dedicated professionals that work within our emergency departments to do a thorough evaluation of these folks, and it goes beyond. You know, you had an interview with Dr. Ellis, and he's an expert, but he's an ER doctor. Mm-hmm. We have behavioral health nurses and psychiatrists that come down and do a real-time evaluation with these folks, and that's so important because really, truly, we want to be able to get people the help that they need. But that answer isn't always in the hospital setting. And if we can divert that, going back to Tony's question of divert to where becomes an issue, but not everyone needs to be in the hospitals. We need to very carefully scrutinize every case and make sure that we're leaving people in a safe situation. So if that means coming into the hospital, wonderful. We're glad to do that or help you facilitate finding that bed somewhere. But if we can get you set up with some outpatient services and a support network, that's still the ideal.
Right now, I'd like you to hear from another local family and their battle to get mental health services for their son. The Meyer family of Cedar Falls, they have a teenage son who needs intensive treatment. Here's their story.
He's 8 hours away. Where's he going to go when he comes back?
Missy Meyer and her husband Jamie worry about the future of their 16-year-old son Jordan, who's undergoing treatment, but not in Iowa, in neighboring Illinois. There is no room for Jordan in Iowa right now.
There is no place in the state of Iowa that has any openings that will fit his needs.
Jordan is autistic and epileptic. He contracted meningitis as an infant. He has seizures and can be aggressive.
So that puts him more in the severe category for the behaviors. When he was home with us for, 2 months trying to get him placed somewhere, we were having to call the cops to come and restrain him. I stayed in Iowa City with him for 3 days for them to come and tell me there's no room available, nor will there be a room available anytime soon. So they basically sent us home with medications and said, here you go.
When they couldn't find a placement for Jordan, both Missy and Jamie had to take leaves from work to care for him at home. And Missy's sister Heather says that takes quite a toll on the entire family.
But imagine being Missy or Jamie and being told, come pick up your kid. We can't do anything for him. I mean, what do you do with that? You have 2 working parents. All the extended family also works. There's nothing in the area, and there's nothing in the state of Iowa, and at one point they wanted to send him down to Florida for it. So finally, luckily, we found something in a neighboring state, but to me that's not acceptable. Him being home really put his parents and his family in harm's way because he is quite a bit bigger. He's 7 or 8 inches taller than his mom and several pounds heavier, and it's not a safe environment for him. When he left the residential home so abruptly, there were threats to put him in a detention center, and they were treating him like a criminal. And this kid can barely tie his shoes. How can you even make a comment like that? Because he needs that stability to get better. And at the time, he was putting on some weight, and it was very clear his medicine was not catching up with his body. So I just think when he was home with Missy, it was an everyday battle with whether it was a good day or a bad day. We were always getting updates on, you know, having to call the cops or going to Iowa City and sitting in a, 6x6 room for 3 days. And for a kid like that, that is not something that they can handle very easily. But I think it's important to know that what we're trying to find for him is stability and routine and mental health support for him, and not treat him like a criminal. He just needs help. He needs to get back on track like he was at the other facility. So definitely more beds in Iowa.
The Myers say they can tell Jordan's treatment is working.
Like, we can tell a huge difference since Jordan's been there. So I'm hoping that he can stay within their program and be in one of their housing units just back here closer to home.
You know, there was a time when nearly every Iowa county had its own way of dealing with providing mental health services. But today, the state of Iowa has been divided into 14 regions under the jurisdiction of the Department of Human Services and the Iowa Division of Mental Health and Disability Services. Now, the Cedar Valley is part of a 22-county region known as County Social Services. Now, County Social Services provides financial support for mental health and disability service programs to individuals in that 22-county area of mainly north central Iowa, including Blackhawk County. And County Social Services is based, however, in Floyd County up in Charles City, and is under the direction of a board of directors and the administrator, Bob Lincoln. So the new system is set up with Waterloo, Cedar Falls, and Blackhawk County, and as part of this County Social Services 22-county region. We saw the family earlier. Their son is being treated out of state in Carbondale, Illinois, 8 hours from home, and it's costing the state of Iowa $1,200 to $1,400 a day for that out-of-state treatment. There has to be a better way.
Yeah, my question with that, Ron, and there's a number of committees working on that, is why are we paying out-of-state providers that type of rate when Iowa providers would be happy to develop services to provide that level of service if they could get reimbursed adequately. That comes back to the cost and the funding, and keeping people local is much better than taking people, especially kids, out of state.
Yeah, we had on the show not too long ago from your area of Parkersburg, from Monarch Services, we had Rusty Eddy on and Kate Haberman, two respected individuals, I believe, in your area and around Blackhawk County, talking about that very issue. You know, they're in business, they have a business, they need to be reimbursed like the other providers in a safe, not safe, but I guess a adequate way that fulfills what they're trying to do as a business, and it's just not happening, is it?
You know, what a travesty for these young kids that are being sent out of state, away from their support system, away from their family. I've got children, and they're young. I cannot imagine someone saying, Chris, we don't have the capability of taking care of your family here, but we do 8 hours away from here, and that's the best alternative we have to offer. It's sad.
So we've seen that these insurance companies, the big ones that are in Iowa right now, that they're literally losing millions of dollars. I think over 300 million one of them lost. So that's part of the problem. But is this an insurance problem as much as anything else?
I think it's also a high utilizer problem. You could take the 15 highest utilizers of the mental health care treatment programs available to them here in Blackhawk County and recognize the millions of dollars that those high utilizers are expending. And
what do you mean by high utilizer there?
So how many times do they seek treatment in the emergency room versus some sort of outpatient community-based placement programming?
So someone who might just kind of like on occasion, or maybe a lot of times, just show up in the emergency room and say, I'm ill today?
I would hate to say on occasion, because I think, quite frankly, it's very frequent.
Okay.
And that's something that needs to be recognized and dealt with too, because I think there is some way to transfer some of those funds. If the state is willing to pay $1,400 a day to staff against a patient outside of the state of Iowa, but in the state of Iowa it's codified that they will only pay to a certain level, that seems odd, because the state is paying that money regardless of where that money goes. So when you recognize being able to treat a high utilizer more efficiently and more effectively through some other means, we're actually building savings into the program.
Right. Chris, let me ask you, maybe this is for a different program, but Iowa's privatization of Medicaid, how has that impacted Covenant Medical Center, and is that the right direction to go?
I don't think that there's a healthcare provider in the state of Iowa that would tell you that it's a real healthy time to be in healthcare in terms of reimbursement with privatization of Medicaid. It just isn't. And you know, we need to shift the focus away from this is how it's impacting the hospitals and back to this is how it's impacting the people that are receiving these services or not receiving these services.
Yeah, I know both Covenant and Unity Point Allen literally give away millions and millions of dollars of free care every year. They do that just because it's the right thing to do, but it costs them literally millions of dollars in lost revenue. But this whole Medicaid privatization has been a serious issue in the state of Iowa, Tom.
Yeah, there's we had one company and now we have three. I'm not sure how three made it better. We got along very well with the one. In fact, mental health care has been managed in the state of Iowa since 1995. So managed care was nothing new to mental health services.
So as we begin to wrap up our show here today, I want to ask each of our panelists, what should be Iowa's next big step in trying to improve our system? Chris, you're down at the end there. I'm going to start with you.
You know, we're making progress in that mental health is finally at the forefront. The stigma is slowly starting to deteriorate, right? And that's wonderful. But there needs to be a call to action. We can talk about this until we're blue in the face, but we have to get our legislators to proactively make laws, make legislation that's going to help us get these people the help that they need. I don't know if that's community-based treatment. I don't know if that's more beds, but something is better than nothing right now, because right now we're barely treating these people with dignity and respect. The services that are out there for them, they're not enough, and we're failing as a state. And these are our most vulnerable citizens in this state, and they deserve the help. And so the conversation is great, but the action has to come next.
Okay. Tom, what do you think?
You know, one of the drums I've been banging in the last couple of years is workforce shortage issues, Ron. With the shortages that we have in professionals, if we don't have the professionals to take care of people, doesn't matter how many hospital beds we have, doesn't matter what type of community services. So I think one of the bills that has been in the legislature the last couple of years is loan repayments. Let's hire, let's train Iowa people to stay in Iowa. Let's repay their loans. Let's make a commitment to building our own workforce so we can take care of people in the future.
Joan, your perspective as we wrap things up here.
I think my perspective has been and will continue to be is families who are encountering this need to speak out and use their voice. I've told people at night, call your legislator, tell them your story, because if they don't hear the stories of how it's impacting all of these individuals, it's just something in the background. But we all need to use our voice and take that responsibility to do so.
And Tony, you have a lot of inmates in your county jail, but what do you see from your perspective of what the state should be doing next?
You know, Ron, when I first ran for public office back in 2008, had you told me that mental health would be such a forefront and such a focus for me, I would have laughed at you. I was a knuckle-dragging cop, ignorant of really what the bigger picture was. And now it's an everyday issue for us. It's an everyday speaking point for me. It's every town hall meeting I hold. I hate the fact that we are criminalizing the mentally ill, and I'll jump on Chris's bandwagon with regard to that. It's deplorable how we treat some of these folks, and not we being law enforcement. We're training CIT, we're training mental health first aid, we're training trauma-informed training, we're training crisis intervention. But again, back to once we have you, possession being 9/10 of the law, where do we take you? How do we resource assistance for you? And right now we are kind of that last line of defense, or at least the first response to then what. And right now the then what is a big question mark that I don't have a lot of answers to.
We have a special web page on kwwl.com. Check out a lot of the information there, resources and phone numbers available to you in this fight for mental health treatment and services here in Iowa. You know, there's no shame in falling down. The only shame would be in not trying to get back up. And Iowa families are trying to get back up and do their best, but the state of Iowa right now is failing them. That's all there is to it. Unfortunately, we are out of time on this very important issue. So I want to thank my panelists here today, Chris Latta of Covenant Medical Center, Tom Ekus of Blackhawk Grundy Mental Health, and also the partnership with Unity Point Allen Hospital in Waterloo and the Cedar Valley. And of course, Joan Becker, thanks for coming back to the program, and Sheriff Tony Thompson. Thanks to all of you for being a part of this very important issue that we'll continue to follow and try to find some solutions as we head into another legislative session here in just a few weeks. Thanks for joining us on this special hour-long edition of the Steele Report. We'll see you next week.